Hello everyone, my name is Hallie Lee and I will be discussing the understanding of depression and the treatments that have been evolved through the years. So what is depression? Well, depression is a mental illness with physical outcomes for your health and well-being. It's made of episodes that can last about 2 weeks, and there are possibilities that it can last several weeks, months, or even years. There is a wide range of symptoms that can affect a person's life. It has the potential to impact one's emotion. For example, feeling anxiety, boredom, guilt, and having a loss of interest in activities. It can affect behavior by having agitation, excessive sobbing, irritation, or social isolations. Sleep can be disturbed by sudden awakening and insomnia. And the body can be affected by extreme hunger, fatigue, or a decrease in appetite. In addition, your cognitive abilities can be damaged by having a lack of attention or having suicidal thoughts. And in terms of weight, you might gain or lose weight, and all these symptoms really depend on the person. Some may not have these symptoms, but some will. And of course, there are several more symptoms that can contribute to depression, but the ones that I just mentioned are the most frequent ones. And according to the American Psychiatric Association, in any particular year, depression affects around 1 in every 15 adults, which is about 6.7% of the population. And 1 in 6 people will suffer from depression at some time in their lives. Depression can strike at any time, but it is most common in late adolescence and early adulthood. And it's known that women are more prone to suffer from depression than men. And according to studies, 1/3 of women will have a significant depressive episode over their lives. And when first degree relatives such as parents, children, and siblings suffer from depression, there is a strong chance that it will be inherited through generations. So we have different types of depression. So there is clinical depression. Clinical depression is also known as major depression, and it impacts on how you feel, think, and act. And it can lead to a wide range of emotional and physical issues. You may find it difficult to carry out day-to-day tasks, and you may sense as if your life isn't worth living. For persistent depressive disorder, for at least 2 years, a person with persistent depressive disorder is depressed for most of the day on more days than not. The mood in children and adolescents might be irritation or a depressive feeling, and it might last at least a year. It affects about 0.5% of adults in the US each year and often begins in childhood, adolescence, or early adulthood. People who suffer from persistent depressive disorder frequently describe their feelings as gloomy, and because these symptoms are becoming ingrained in the individual's daily life, they may refuse to seek help, claiming that they were always feeling like this. And for bipolar depression, it's not the same as for bipolar disorder, it's not the same as depression, but it is included in this category because bipolar disorder patients have periods of incredibly low emotions that satisfy the conditions of serious depression. However, an individual with bipolar disorder might have exceedingly high, ecstatic, or angry moods known as mania, or a milder variety known as hypomania. And during childbirth or just after delivery, women can have postpartum depression, developing severe depression. Postpartum depression can create a challenge for mothers to perform ongoing care tasks for themselves and/or their infants due to the emotions of severe grief, worry, and weariness. And depression is actually one of the most highly treated mental illnesses, and between 80 to 90% of individuals with depression react effectively to treatment in the long run. Usually, a health practitioner should normally undertake a complete diagnostic evaluation, which includes an assessment and a physical examination before providing a treatment. Sometimes a blood sample may be required just to ensure that depression isn't caused by a medical condition such as a thyroid problem or a vitamin deficit. And with the purpose of reaching a diagnosis and determining a course of action, the examination will define key symptoms and analyze the family's medical histories, as well as cultural and environmental aspects. So there are a variety of treatment choices available, including psychotherapy, medication, and electroconvulsive therapy. So psychotherapy is often used on its own to treat minor depression. However, it is frequently used in conjunction with antidepressant medicines to relieve moderate to severe depression. CBT, or cognitive behavioral therapy, has been demonstrated to be useful in the treatment of depression. CBT is a type of therapy that focuses on resolving issues in the present, and it teaches individuals to notice misguided thoughts and to change their ideas and actions so that they can react to situations in a more positive way. Psychodynamic therapy believes that depression is caused by internal conflicts, which are frequently unacknowledged and stem from childhood. The purpose of this kind of treatment is to assist the patient to become more conscious of their whole variety of emotions, including the contradicting and unpleasant ones, as well as to help the patient better endure and put these feelings into place. Psychodynamic therapy, unlike certain forms of depression treatments, are less concentrated and more long-term. This method can be helpful in identifying links between previous experiences and determining how those experiences may have contributed to feelings of depression. This method can also aid in the development of self-awareness and the enhancement of specific emotional capabilities. And finally, interpersonal therapy deals with the problems by exploring the past and present roles in society and interactions. And throughout this treatment, the therapist usually concentrates on one or two critical issues. This form of therapy is generally fast and entails reviewing crucial people in his or her life's social relationships. And for example, this could be a connection to your lover, friends, family, and colleagues. And the idea is to figure out how these relationships affect your life and how to resolve disagreements. And when it comes to medication, brain chemistry can play a role in a person's depression and treatment. And as a result, antidepressants may be administered to aid in the modification of one's neurochemistry. Antidepressants may provide some relief in the first week or two of the treatment, but the full effects may take 2 to 3 months to appear. If a patient doesn't feel better after a week or after a few weeks, his or her psychiatrist may adjust the drug's dose or add or replace another antidepressant. Other psychiatric medicines may be beneficial in some cases, and usually psychiatrists advise patients to keep taking their medicine for 6 months or longer after their symptoms have eased. Finally, we have electroconvulsive therapy, which is also known as ECT. And it's a medical treatment that has been traditionally designated for individuals suffering from severe major depression who have failed to respond to conventional therapies. While the patient is sedated, a short electrical activity of the brain is performed, and ECT is usually administered 2 to 3 times each week for a maximum of 6 to 12 treatments, and it has been utilized since the 1940s. And years of scientific research has resulted in significant advancements and acceptance of its efficiency as a mainstream treatment instead of the last option. So why should we care about depression? Well, the most important thing is because of our emotional and mental health. Our emotional and mental health is significant since it affects our ideas, habits, and emotions, and it is a vital component of your life. Emotional well-being can boost performance and productivity in activities such as jobs, education, and parenting. And day after day, you can take action to improve your mental well-being. And you can do tiny changes such as exercising, eating healthy, opening up to individuals in your life, taking a break whenever you need it, and getting a good night's sleep. You can communicate with several people, such as your friends, your family, reaching out and sharing your feelings with those in your life that can provide emotional support. You can also speak to professionals such as psychologists and psychiatrists to get the individualized help you require. And that's all I will be talking about today, and these will be the sources that I've used. And thank you for listening to my presentation, and I hope everyone stays happy and healthy. Thank you.